if a baby contracts hepatitis B at a young age, there's a 90% chance that they'll become chronic carriers. So in other words, throughout their life, they will have hepatitis B, and they go on to develop things like cancer of the liver or cirrhosis of the liver.
At Fedhealth Medical Aid, nothing's more important than the well-being of your baby and little one, which is why our FlexiFed 2 and 3 plans enrich your pregnancy and parenting experience with benefits like unlimited GP visits, a doula benefit, a private ward for delivery, trauma treatment in a casualty ward, and our free Fedhealth baby program. To get more choice, flexibility, and control from your growing family's medical aid, call Fedhealth today. Fedhealth, we let you be you.
Lee Baker is back at Baby Brunch, and we're excited to let you know that you can find her on Amayeza Info.co.za. Lee, how are you doing?
Doing well, thanks, Lana, and you?
I'm great, and it's the month of July. Well, we say in the month of July, we focus on hepatitis. Why would we highlight and almost create awareness around hepatitis in the month of July?
Okay, so the reason why we do it in July is because it's to remember Dr. Bloomberg, who actually discovered the hepatitis B virus. And it was his birthday on the 28th of July. But it's a very good opportunity because there are so many cases of hepatitis in the world that go undiagnosed. And it's just in our own country, they're considered to be more than 3 million chronic carriers of hepatitis B. So it's something we really do need to highlight, and July was a good month to do that.
How old should one be to vaccinate for hepatitis?
Okay, so hepatitis isn't a disease on its own. Hepatitis is inflammation of the liver, and it's caused by a lot of things. So we talk about the alphabet soup of hepatitis because we have hepatitis A, hepatitis B, hepatitis C, hepatitis D, and then we have others causes that aren't viral at all. But so the two that we have vaccines against are hepatitis A and hepatitis B. And in our country, we give hepatitis B to our babies at 6 weeks, 10 weeks, and 14 weeks. And the reason why we do this is because if a baby contracts hepatitis B at a young age, there's a 90% chance that they'll become chronic carriers. So in other words, throughout their life, they will have hepatitis B, and they go on to develop things like cancer of the liver or cirrhosis of the liver. So that's why we focus on vaccinating our babies at that young age. Hepatitis A, we start from 1 year of age.
Okay.
And then we give them 2 doses 6 months apart.
I remember that. So why do we give the dosage 6 months apart? Why can't you have it all at once?
The first dose primes your immune system. So it gives you a very good response. The second dose is what gives you your lifelong protection.
Right. What's the difference between hepatitis A and B? I mean, I love how you refer to it as a soup because there's many. But what's the difference between A and B?
Okay, because they're transmitted differently. Okay. So hepatitis A is basically something that we call it fecal oral transmission. So you can get it from contaminated food or water. And you can also get it when you are actually looking after, for example, a baby who's got hepatitis A and you're not using good hand hygiene. And then you can contract it from there. So that's how it's primarily transmitted. Whereas hepatitis B is primarily transmitted through semen, through blood, and through other body fluids. They also have different incubation periods. Hepatitis A is usually at 28 days. Hepatitis B can be up to 3 or 4 months. But the symptoms basically are that of inflammation of the liver, irrespective of what the cause is.
So what would happen? What are the symptoms?
Yes. So the symptoms are primarily you lose appetite, you're apathetic, you have a fever, you can have a headache as well. But ultimately what we recognize is that you get jaundice. So your skin goes yellow, the whites of your eyes go yellow, you have very pale stools, and your urine is very dark. And all of that relates to the inflammation of the liver, not specifically what caused it.
Right. Would the baby or adult become very ill if they had it? I mean, is it something that blows over, or do you recognize, okay, I'm actually really ill?
Okay, so from a baby's perspective, they don't have symptoms. They're mostly asymptomatic for both hepatitis A and hepatitis B. The older you get, the higher your incidence of symptoms and the more dangerous it is to you. But like I mentioned with hepatitis B, the babies that contract it don't have any symptoms, but they're the ones who become chronic carriers. Wow. If you contract hepatitis B when you're older, you'll be very sick, but you won't be a chronic carrier.
Right. I mean, I've now learned how one would contract it and also what the symptoms are. If you haven't been vaccinated as a baby for any of the hepatitis, could you get vaccinated as an adult?
Absolutely. We've got adult vaccines for both hepatitis A and hepatitis B. And in fact, all our medical students, all the students going into university as medical students, all get given booster doses of hepatitis B, even if they did have it as babies.
Right. One of the questions that we had to babybrunch.co.za was, can a baby be born with hepatitis?
So it can be born with hepatitis B. Okay. And that is a major problem, especially in a country like South Africa, where we have a lot of HIV positive moms, and hepatitis B and HIV often go together. And the mom can transmit hepatitis B to the baby in utero.
Well, in the month of July, we say we are creating awareness around hepatitis. World Hepatitis Day is in the month of July. Lee, it's always wonderful seeing you. And if you want to see Lee and the rest of all her amazing people, you have to visit this website. So it's Amayeza Info.co.za, Amayeza Info.co.za. Lee Baker, I always say Lee Barker. Lee Baker from the Amayeza Info Centre. Thank you so much for joining us.
Thanks, Alana.